please, doctor, I don't want anyone else getting involved.
Hello,
Hello.
my name is Donald. I'm one of the doctors in the surgery. Is that Sophie Wilson?
Yeah.
Hi, Sophie. How can I help you today?
Hi. Uh, sorry, I'm getting really bad anxiety. And money is
I
tight,
can
and
see
I'm
you
not.
are, I can see you are struggling a bit and scratching on your face. Um, Feel free, and we do see these sort of things regularly. Everything you discuss here will be confidential. So if you tell me
Okay.
a bit more about what's been going on, okay?
Yeah. I just got into a big argument with my husband last night about money. Um, yeah, and I just don't really know what to do. Money is really tight, and
Mm.
I don't really. Yeah, sorry, I just don't really know. I didn't know who to talk to.
Mm. Thank you for coming forward to share this with me. We would work together to see how we could help you. Is that okay, Sophie?
Yeah, yeah.
So, if you wouldn't mind, could you tell me a bit more so that I could understand better? You mentioned you got into a bit some argument. If you just give me a little bit more background, what's been going on?
Um, yeah, money's just, well, we don't have any, um, with like cost of living and everything like that, and
Mm,
we keep fighting,
mm,
um, and he says horrible things,
oh
and
dear.
now I'm not sleeping.
Mm.
Um, I just, yeah, I don't really know. I just don't really know what to do. Yeah.
And with everything happening, Sophie, have you given any thoughts what the problem might be? And I know you've mentioned money and anxiety. Uh, what what has gone through your thoughts? What might be going on?
Money, money, I guess.
Mm,
And then that just makes everything harder,
mm,
and then it makes him say horrible things, and then
mm. I see. That sounds difficult. How have you been managing?
uh not very well.
Mm. And when you say not very well, could you tell me a little bit more? Would you be needing help? I
Uh
can see you are looking down.
uh
This
yeah,
looks
I
for you.
yeah, I just don't I just feel a bit trapped. I don't really know what to do.
So when you say you feel trapped, trapped how?
Like, I don't know how to solve it. I don't know how to
Okay.
make it better.
With the money situation. So let's work together and we'll see how to help you. And you know, you say you feel trapped. Is that the major particular thing that worries you?
uh, I I don't know. I don't know what
All right, let's pause here. So you can see that this patient feels a little bit helpless right now,
Hmm.
and she's not able to actually articulate. So
Yeah.
what you need to be doing here is thinking what could be the potential risk here. Can you see on the case note, she's got a son, she's had a
Yes,
fracture.
safeguarding issue.
So
Yeah.
use information and try and bring things forward and see whether there's anything else. because one of the things I'm thinking here is that could be more to it, but she's not comfortable to ask to answer. Okay.
Yeah.
So you say something like, I can see on the record you've got a son. How things in
The
your
home.
household? Yeah.
Yeah. Okay. Hello, Sophie. I'm looking on the records. I could say you live with your son.
Yeah.
How are things at home? Does your son witness all this going on?
Oh, no. I make sure that he doesn't see anything. Yeah, it's always between me and my husband. Yeah,
And can I double check with you? How old is your son?
he's 3.
3 years old. Okay.
Yeah.
And with when you arranged this appointment today, was there anything in particular you were hoping we could do to help?
I'm sorry, doctor, I don't know. I just needed to speak to somebody.
So we are here to help, and we would see how to help you. Is that all right? I would just want to ask some specific questions to understand few other bits probably going on. Is that okay?
Yeah.
So you've told me of your husband hitting you and saying some wrong words to you.
I never said that. I said
Oh,
we had an argument.
argument. Oh, I'm really sorry. So, but so that means he does not hit you. Is that correct?
Sometimes he's throwing things. He doesn't. That's not what happened last
Okay,
night.
let's pause here. So you just actually made a big mistake how you actually frame this here, and then you put words in this patient's mouth. So just be careful, okay? So the way to frame this should be, sometimes when people have argument, they get carried away and they sometimes do things that
Yes.
they don't want to. So has there been any escalation? Have you felt threatened? Something like that.
Mm,
Okay.
mm, yeah.
Right, let's continue.
Okay. So Sophie, sometimes when there could be argument like this, things might get out of hand and it might get physical. And has this been the case with you?
Not last night, but sometimes
Okay,
he's thrown things
that's you.
and hurt me. But
Mm,
that's not often, and it wasn't last night. Last night was about money.
yeah, I completely get that. How has your mood been, Sophie? With all this going on, how has your mood been?
I mean, my anxiety is crippling, uh, and I'm crying more,
You are what more? I didn't get
crying.
cry. Oh dear, dear. That sounds distressing. And sometimes when people are struggling with anxiety, they may have dark thoughts coming into their mind. Is that the case with you?
No. I've got my son. Like I would never, but I just don't know what. I don't know what the answer is.
Yeah. So Sophie, it sounds difficult what you are going through. Let's work together and see how we could help you. From what you've told me, I think what is going on is some domestic violence
No,
going on.
no, uh, uh, no. It's things are hard right now. Um, uh, uh,
I do appreciate that things are hard with money. Um and you have actually mentioned it's kind of driving your anxiety and the argument you had. So in terms of what we could do to help, you wanted to talk to someone. So we could arrange for you to talk to someone. It's called talking therapy. Is that okay? And that will be quite helpful to talk things over.
Is it anonymous?
Yeah, if you like it to be anonymous, we could arrange it to be that way. It could be anonymous. In addition, there were other things I think are quite important for us to do to keep you and your son safe. Would you want if I share that with you?
Well, what sort of things?
So usually when we have a situation like this, we like to make a referral to the social services.
No, no, thank you. No, thank you, doctor.
You wouldn't want social services involvement.
No, no, they'll just come in and they'll take everyone away from me. No, thank you.
Usually the social services are not there to take away your children. They are there to keep you safe. And taking away the child is the last option, the last resort.
But they still could. And I'm trying really hard to keep them safe. I don't want them getting involved. I don't want anyone else getting involved.
Yeah, Sophie. In this case, we really do have a duty to involve the social services. I know you are worried about them taking your child, but that is usually the last resort. And in your case, I would also put some of the good things you are doing. I will put it in the referral. And these are also very good points for you. It will reduce the chances of them taking the child.
Reduce the chances, exactly. That's what you're saying. You're saying that like it's possible that they're gonna come in. I've done. Please, doctor, I don't want anyone else getting involved. I don't know what I want, but I'm doing the best that I can.
Yeah, I appreciate that it's a difficult time for you. Um at this point in time, I have a duty to
Okay,
take
let's stop here.
yeah.
All right, it's quite a really intense case, and I think the problem in this case is that if you have already shot yourself in the foot, you've broken the rapport, it's very difficult then to redeem yourself after what's happened. So you have to be very careful what you say, okay? Because some of the slip of the tongue and phrases that you're saying is actually making the situation worse. Let's hear it from the role player.
Hello, hi Donald. Yeah, sorry, this is a not an easy case. Yeah, I would second that. I think just something to be really thoughtful around in this stuff is the language used. I think Sophie, uh, she doesn't know quite what the answer is to her situation, but words like domestic abuse and social services, obviously, that yeah, there maybe are other ways of framing those things. Or I know social services, that's their name, but maybe there's a slightly different way of introducing them to the situation. And I think just the language saying that they reduce that certain things will reduce the chance of them taking the child away still meant that the child being taken away was very much a real possibility in that moment. And I think that would completely shut her down to engagement. And I think yeah, I think the main thing is just careful with certain language and um allowing them space to kind of talk, even though that it probably wouldn't be a hugely fruitful consultation on the first go. But building the rapport, I think, is this is very personal, is possibly really important to allow the patient to open up truthfully about what's going on at home. Yeah, but well done. It's not an easy case to do, and there isn't really a happy ending. So
Thank you,
yeah.
Rachel. So what's really important is that if you notice that the patient is not forthcoming, there could be other reasons. So you have to show that you're thinking about her safety. So maybe also check in the beginning, like, is she on her own right now? Is she safe to speak? Because sometimes with this type of scenario, there could be other people around, so she might not be able to speak very well. And then I think it's very important that when you're taking the history, you're thinking that there's quite a lot of things going on, and if you're not getting much, then you have to shift gear and see whether you can explore other things. So that's why I stopped you and thought it should be thinking safeguarding issue of the child. So asking a little bit more about the son, and also asking a little bit more about the family dynamic, because sometimes there could be other issues that could make somebody actually arguing a lot. And in this case, unfortunately, you didn't get that. So the spouse was actually drinking a lot of alcohol, so that was a risk here. So make sure for any case where there is risk, think about whether there's alcohol abuse, drug misuse, could be other things going on, and that could perpetuate this problem. Okay, and then when it comes to the actual problem, the way you label it was a bit stigmatizing. So don't say domestic violence, or although you know what it is, you should be saying it in a different way where the patient doesn't feel like um, they're stigmatized. So it should be, it sounds like you're feeling trapped and you're in a situation where the relationship has been quite challenging and you're looking for help. See, like use the patient's own words if possible, then they will feel like you really understand them. And then in the management plan, yeah, I think it's good you recognize the safeguarding. I think that the way you frame it should be more as in the social services are here to support family to stay together, and as you have mentioned, things have been quite difficult at home with finance, so they could look at how to support you, whether there's any benefits that you could be eligible to apply for example. All right, so the frame should be more as in I'd like to get some support so that we can make sure yourself and your son well-being are being taken care of. Okay, do you have any questions?
I think it's clear. I recognized what was going on, but the dragging nature of the data gathering, she wasn't forthcoming.
Yeah.
Yeah, it was also heightening. You have 6 minutes. And yeah, I think I've learned a way to do it better. Thank you.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.